In this video, we will continue our mini-series on how the kidneys work. So let's start with the idea of osmoregulation. Osmoregulation is basically the... What is that? Ah, there's an ambulance. Anyways, back to where we are. Osmoregulation is basically the control of water and solute concentration in the blood. So the process ensures constant water potential in the blood. So what is water potential in the first place? I don't really know. Let's search it. But we all know that it's important. That's a given. Sorry. It's not working. I guess we'll just have to deal with what's in this reviewer of mine. So water potential of the blood has to be constant. So osmoregulation makes sure that this is maintained. This idea is true. So, or the requirement from this idea is carried out properly. So we know it is recognized that kidneys are considered osmoregulators. They help regulate what? Water and solute concentration in the blood. And if there's no regulation, then our blood will not be clean. That's basically the role of the urinary system. The kidneys play a very important role in defining the urinary system's place in the body. So the kidneys have nephrons. So they control the amount of water that is reabsorbed at the nephrons. So the nephrons are inside the kidneys. So check this. The amount of water that is reabsorbed can influence the blood volume. So what is the relationship between the water potential of blood and blood pressure? So the higher the blood volume, then the higher the blood pressure. So there can come a time when high blood volume, high blood pressure, you can get extreme blood pressure and it could result to stroke. So what is the solution for that? What is the solution to stroke? Well, it is known that a diuretic prescription is going to help. It's intended to help. Diuretic, in other words, water pills. This is intended to decrease ADH or antidiuretic hormone level, as well as the volume of water in the blood. So as you can see, there is a reduction with the arrow down. And at the same time, this increases the amount of dilute urine. So if you drink a lot, or in Filipino, if you drink, kapag uminom ka ng sobra, it's basically classified as hypotonic or dilute water potential in the blood. So in other words, low blood pressure. So that's the reason why if you drink a lot, it helps alleviate the problem of having a high blood pressure. And if you drink too few, if you don't drink enough water, the tendency is you'll get a hypertonic water potential in the blood, and your blood pressure will increase as well as your ADH levels. Antidiuretics are for those who have low blood pressure in order to have ADH produced, which is intended to reabsorb more water. So what are the common causes of kidney failure? So first things first, know this. The urinary system has close connections with your blood pressure. So if you don't take care of your kidneys, you are at risk of, if you have blood pressure, then you're at risk of having kidney failure. I'm not sure if it can be said the other way around. As a result of kidney failure, you can have high blood pressure, but just believe on what's stated right now. So high blood pressure, too much antidiuretic hormone synthesis. In general, in life, it's ideal to have things in moderation, especially that includes hormones basically. And ADH, if it's too much or too less, it's dangerous. So higher blood pressure, it's synonymous to having too much ADH. Another cause is diabetes. You have too much sugar. I'm just not sure if it's both type 1 and type 2, but definitely type 2 because that's what you get for consuming too much sugar. Type 1, you were born with it. Another cause is alcohol abuse. You're alcoholic. You're damaging your liver. So, next is extreme physical damage to the kidney. Of course, it's kind of obvious. Kidney failure, that means your kidney physically is damaged. And yeah, aside from that, complications from surgery. That's the reason why patients and doctors sternly discuss about what is supposed to be considered before opting for a surgery, because there can be complications such as this. Kidney failure is a possible risk in certain procedures. So what are the features of a dialysis machine? I was supposed to copy, but I guess I wasn't able to. But yeah, this is from my teacher's presentation. So the dialysis fluid contains the same concentration of essential substances as healthy blood. So basically, a dialysis machine intends to imitate, in a way, how kidneys filter your blood. But yeah, the machine isn't perfect. Although yes, it works. It can work as a potential substitute. It was able to extend life for quite a while, but yeah, long-term living afterwards isn't ensured. But yeah, don't take my idea for don't take it as if there's no consideration. Of course, each case is different and unique. So yeah, it still depends on the situation of the patient. Another is dialysis fluid does not contain metabolic waste products. I'm not sure why, but yeah, that's how it is. The tubing in the machine is narrow, long, and coiled. And lastly, the direction of blood flow is opposite to the flow of the dialysis fluid. So I won't cover too much on what a dialysis machine does, like in terms like how it performs its work. But yeah, certainly it's one of the solutions offered when you have a problem involving your kidneys. I believe this is to address kidney failure, if I'm not mistaken. But yeah, that's all I know. That's it for this video. Thanks for watching.